People are rolling in slowly.
How many do we need for quorum? I think I count 8.
We need 8.
Okay, then I think let's go ahead and get started. I know Pam will be joining us a little bit later, so we'll have our 9. Thank you everyone so much for being here, and we want to move this along because we've got some important stuff to discuss today. I am your chair, Debbie Jones. I'm a prevention specialist in Wasco County and run an organization called Youth Think. And with every one of our meetings, I want to just start again with our definition of what this subcommittee does. And we are specifically with the definition of primary universal prevention, which is the practice, programs, and policies designed to prevent and reduce the incidence and prevalence of alcohol and other drug use and their consequent health conditions, behavioral health, and social problems. So just to do that level setting, pretty soon I'll be able to do it without having to look at the paper, but I'm still want to make sure I get it right. So I welcome all of you here. And I think, Ashley, I saw in the chat that you were going to do our roll call for us. So let's go ahead and get started with that, please.
Great, thank you. All right, I am going to do roll and I'll call you by your first name. So just say here. Let's start with Carolyn.
Here.
Dwight. Francis. Francis, okay.
I think is that Frankie?
Yeah,
Francis?
Frank.
Oh,
Yeah.
sorry.
And I think
I'll
was
get the
Dwight
third name.
replaced?
Dwight was replaced with Martin. Yeah.
Okay.
Oh, I need to
Ashley,
update the
we've given
sheet.
you an old list.
That's okay. Hey, first time's a charm. So we've got Jessica.
Here.
All right, Lindy.
Here.
Tony.
Yeah, you can scratch Tony. That's fine.
Beth.
Here.
Great. Alexis.
Here.
Amy. Amy Zimmerman. Zeb.
I'm here.
Great, thank you. And Amy, M, Shauna, and Luis are excused today, and Pam and Darren will be joining late. Did I miss anybody? I think I need to update my list, so I do apologize if I missed
I think
anybody.
Tim.
Okay, Tim.
Present. Yep.
Great, thank you. Okay, thank you guys.
Thank you so much, Ashley. And just to give you a quick overview of our agenda, we'll have our director updates from Annalise Dolph and Wes Rivers. Wes is going to help us do a little bit of level setting on our Center of Prevention Excellence. I'm already playing with the name. We'll have a great discussion on the scope and then make sure we have some time for public comment. So with that, I'd like to turn the time over to Annalise and Wes for our director's updates. Thank you.
Thanks, Debbie. I will be quick and hand it over to Wes if he has any additional updates. The full commission met earlier this month. I had to actually look at my notes because it seems like it was more than a month ago, even though it was 2 weeks ago. And heard from OHA about the Rural Health Transformation Program, which was very helpful. Next month in April 13th is our next meeting. We will be hearing from some of the schools on the pilot work that Wes has been doing. We're going to have a chair and vice chair election, and most excitedly, we're going to have our first 2026-2030 comprehensive plan quarterly update. Obviously, we're 3 months into a 5-year plan. So I would say it's not quite enough that we can get like necessarily the most accurate metrics to see how we're doing, but we have a lot underway already. So if you're curious about that, in particular, if you're curious about our multi-state agency financial assessment, which is kind of higher level, and then there's the 3321 primary prevention, we'll be giving a good update on that. So that is full commission work. The opioid settlement board met earlier this month and meets again next week already to talk about the final allocations for this biennium. We have about $10 million left. It is looking like the board would like to do a request for proposals with some guidelines for the community, since we haven't been able to do one of those big RFPs yet. So just know that the board is meeting next week. There'll be a public comment period before the discussion. So as always, we'd love to hear from the public with any guidance on how we allocate those very precious dollars. I think that is all I have. Happy to take questions. And Wes, do you have any announcements?
No, I just Debbie had asked me to just give you a brief update on the HB 3321 assessment. That is chugging along in conjunction with our larger state agency financial analysis. So Tim has been getting together with the agencies to have direct conversations about any of the programming financially, both the budget teams of those state agencies and the program teams are submitting financials to Tim and our team about the broader continuum of care as well. So Tim and his team, as you'll see here in a second when I go through our work plan for the next year, they'll be coming next month and be coming every other month to fill us in on what's happening with the HB 3321 assessment. So kind of a more in-depth update to come.
Great. Thank you both, Wes and Annalise. And since we're a tiny bit ahead of schedule, just maybe a few updates so this subcommittee knows other things that are happening. And I see Deborah here. So there is a planned summit that HIDA, they co-sponsored one last year, and this is kind of a second. And that is, you'll be hearing some things about that in the very near future. So it's an exciting, again, specifically around primary prevention field. So look for that, as well as our Northwest Prevention Transfer Technology Center will be doing a leadership academy in August. So make your summer vacation plans around some learning opportunities, and we'll get some dates out about that very soon. But wanted to make sure that you knew that there's work going on in that, as well as the Oregon Coalition of Prevention Professionals is continuing to offer the cohorts that we were very grateful to be able to receive funding through the opioid settlement dollars. I think we have one coming up in Deschutes County for the prevention core competencies, and we'll continue to kind of move those around the state. So if you have any questions on that, you can send those to me. Between Wes and I, we're just one big, beautiful head, but he has better hair than me. So I'm going to leave that at that. And Wes, let's go. Oh, just to kind of remind everybody, we'll have definitely discussions. We'd like to make sure discussion opportunity is open first to our voting members. We'll see how time's going, but we definitely how we have at least a minimum of 15 minutes scheduled for public comment, and we really encourage and appreciate that. So with that, Wes, if you can do that little level setting on our main discussion today.
Yeah, happy to. Ashley, do you want to pull up slides, please?
Pulling it up right now. Can everybody see that?
Looks good. Thank you. All right. So as we had talked about at our last meeting, the Center of Excellence and the work around HB 3321 are going to be our main pillars of work over the next year. And so one of the things that when talking to Debbie and Luis about how we should roll this out, we talked about the group needing just to center ourselves back on what the Center of Excellence was and what we talked about last year. So we received a really big presentation from our contractors, Third Horizon, on some of the work that they did with Northwest PTTC and the ROTAC in doing just an environmental landscape of what's out there. Now it's really up for this group to start to discuss the details and also, right, what's missing from what you heard? Where do you want to go and where do you want to take this? Is it falling within the vision of what you all thought about when you put forward this concept last year? So this presentation does a couple things. One, it just kind of reminds you what y'all talked about last year. Two, it kind of sets a timeline for how we can go about these discussions. And three, it pulls out some of the themes from that Third Horizon report of where we need to spend our time. Now, there might be other themes that we need to talk about. And I understand that folks have raised a whole bunch of questions. We try to capture all of those, and we'll be using those to lead discussion as we move forward. So this is conversation one of the every month we're going to have another conversation about this center. And by the end of the year, I hope we have something that's tangible, that feels good, that meets everybody in this room's needs. Okay, so we'll just start there. Let's start with what we talked about last year. Ashley, could you advance the slide, please? So this is verbatim what we voted on last year. Okay, so strategy number two, establish a prevention center of excellence, name to be determined. Okay, this is what we're going to call it for the purposes of these conversations. And at the end, maybe we'll do some sort of prevention committee uh, uh, contest for naming the center of excellence.
Hey, Wes, can I pop in here real quick?
Yep.
I know we're going to two, but I want to really emphasize the first one there, baseline. Again, there was considerable work done, and this is not to point any fingers at any department, entity, or anything like that. This was not just a local, it was a regional, national discovery of what could be. So some of you, again, as we have guests on this Zoom, might be looking and say, well, we do that. But again, this is that collaborative, really coordinated effort. So it's not anything that we're trying to call anybody out. You don't do this. It's just establishing that baseline. And now what can we do to make it better? So I just wanted to also kind of share that because I'm very appreciative of the people that are joining us who are not voting members, that there's no offense taken in any of this, but we knew as a whole we can do better. So that's my little commercial. Sorry, Wes, take it away.
Yep. Okay. So establish a prevention center of excellence to expand the implementation of best practices and support the growth of the primary prevention workforce. Okay, so that's kind of the headline of what you all wanted to do. Baseline to Debbie's commentary, y'all asked for a lot. And so it makes sense that no single entity would have every single one of these things. And maybe they do a little bit of all of it, but not the full package, so to speak. And so that's really important for establishing the baseline is y'all are asking for a lot, and that doesn't quite exist yet for the state. So Activity: launch a center of excellence that can provide technical assistance, evaluation support, and system-wide implementation of prioritized strategies aligned with a comprehensive plan. Short-term goal: scope of work and governance structure of COE developed. That's what we're going to do over the next year. Procurement process taken to solidify infrastructure in Oregon. That's something that we might do in 2028, 2027, 2028. Midterm process goal: COE positioned to support regional ADPCs and other partners with tools and resources to advance primary prevention strategies in K-12, collegiate, and community spaces, including in high need, more underserved areas of Oregon. And then finally, long-term process goal. So this is by the end of our comprehensive plan cycle and into the next comprehensive plan cycle. COE provides consistent support to partners statewide in the implementation of best practices. COE provides opportunity for homegrown innovations to receive evaluation support and is able to deliver to ADPC recommendations on ways to continue to expand local capacity. COE or hub, how that used interchangeably in our plan, is fully operational and recognized as a central infrastructure for prevention statewide. Certified prevention specialists' workforce capacity gaps are reduced. Just gonna pause there. Can we take the slides down just for a second? I want some nodding affirmations that everybody remembers these conversations just quickly. Okay, perfect. And everybody still feels good about this as our overall #1 target for this year. Perfect. All right, great. It's really important that we set this baseline, and it seems silly that I'm asking that, and I'm putting the slides down. I think it's really hard when we have these conversations kind of stacked onto each other just to kind of remember that place that we were in last year. And so I'm just trying to center us back on that so we can use the work to move it forward. Yeah, Jessica.
Thanks. I don't know if this is the right spot to ask this question, but because I'm new, I'll play the new card for a little bit longer. New to the group anyway. I'm curious if there were discussions around how to bolster the existing workforce. So I understand the Center of Excellence and the need around technical assistance, and that there may be money going to that. Is there a simultaneous effort to ensure that we have, a workforce in place across Oregon so that every county has a baseline prevention workforce? Like, or is there simultaneous kind of thought around that element?
Yeah, great question. I can start maybe, and then the group can fill in. So, that this is part of a two-pronged strategy for this year, right? So, HB 3321, right? We all understand the current funding climate that we exist in right now. HB 3321 is to really kind of see how we're spending money across the state through different programs, through different state agencies, through local homegrown efforts, through CCOs, all of it. Utilize that information plus the Center of Excellence to start to think about how we can better support the current workforce. That might look like thinking about how do we make investments differently. That would be something that this group would utilize when we look back at the reporting and see to kind of figure out, are we supporting the workforce as best we could? Are there additional investments that could be made? That all will come in this like second stage of strategy 1 of HB 3321. So really harness, what do we need? What are the gaps? Are there ways that we could be spending more money from different levers to support the existing prevention workforce? And then on top of that, as we design the COE, having that workforce support, and that I think the prime audience would be the existing workforce, especially at the beginning. But we all have to decide that over this scoping conversation, right? But as a workforce capacity tool in and of itself, the Center of Excellence was really thought of as a tool for the existing workforce and then expanded beyond workforces that are adjacent. So teachers or early childhood professionals, those types of that workforce who might be touching the prevention system, but might not have direct access to some of this information and support. Beth?
So it's I'm hearing you say it's when it launches, it's serving the current profile of primary prevention in Oregon.
Jessica, I would say that this is it through this effort and the interviews that Third Horizon did, and it was definitely not looking at who does it, how much money would it need, or anything like that. It's like laying that foundation. And like Wes, I really appreciated him saying, who else besides that workforce is maybe doing some work that we can start to help people understand, hey, you are doing primary prevention. Let's align our efforts more. So I think it's this opportunity to tell the primary prevention story really is upstream. And then being down the road, as Wes said, started lining it more. But it definitely is, I would say, we're not even at laying the foundation if we're building a house. We're still at that stage of working with the architect. So it's very open, and I think hopefully in this discussion, as we have other people here that could say, hey, I'm in this lane. This is where I could see maybe I could help more of my families, for example, say they're a home visitor. And it's like, are there some things that really fall into that primary prevention science that I could be sharing that builds this whole infrastructure for a healthy, thriving child, youth, and future adult, if that makes any sense.
So it sounds maybe like, so the Center of Excellence would serve Oregon, but kind of on a voluntary basis. There's not really coordination around the prevention work yet.
We haven't scoped that yet. So
Okay.
that's for these conversations to decide.
Okay.
Yeah.
Beth.
Oops. Hello, everyone. Let me lower my hand here now. Yeah, okay. I just had a couple of comments. First of all, I really appreciated those slides, Wes, because it just kind of shows us the process we're in. That was super helpful. I think the idea of a center of excellence is excellent. It would be amazing to have a center of excellence in the state of Oregon that operates in the way I think we've been discussing it. I just want to clarify a few things. Then I think I heard you say. So this group is going to write the RFA for this Center of Excellence, or at least provide feedback on that. Is that correct?
We are going to write the concept that could be written into an RFA. I want to be very clear. We
Yeah.
do not have money yet. And so
Yeah.
I think my hope is that we are creating something that could turn into a funding opportunity. That's
And
right.
then who will review the proposals to decide who's the Center of Excellence?
Great question. We would decide that in the governance portion of this. So as we think through who owns the Center of Excellence, that would be part of that. Although I've heard strong emphasis by this group that they want to be part of that conversation.
Mhm.
So I think in some way, if we think about the ADPC committee as being, I think there should be some assumption that the ADPC committee, the prevention committee, will be part of that process in some way.
Oh, that's good. I mean, I just think it's going to be, again, totally support this. But I also know that we could create a situation where we create some kind of center of excellence that isn't effective because we haven't thought through all of the aspects. And I kind of think that's what you were getting at, Jessica, which I appreciate your question. I would hate to see us spend a bunch of money on something like this that really just kind of creates more levels of confusion and chaos and isn't funded properly to actually really help people. So I just think it's going to be super important for this group to really think through what we're looking for in a center of excellence, and in particular, who could possibly do that in an effective way in this state. And I think I really look forward to those conversations. But I guess what I'm trying to say is I don't think this is going to be easy. And I think it could easily be something that isn't really a good use of time or funds. I just think we need to be very careful with it. And especially given our lack of resources in the state, what are we going to do? What can we do to make an impact here? And what would that look like? And I think, I look forward to those conversations.
Thank you, Beth, and Jessica too, and Caroline. I'll get right to you. That is why we are going, at least right now, at kind of I would, a snail pace, because we want to. All those questions that you're asking, don't be satisfied until you get an answer that satisfies you, because we want to unleash everything to see, okay, how will this impact that? How will this impact this? So that's exactly the process we want to continue to do. So no one is ever going to be a negative Nelly on this. It's more like, hey, we want it to work, and this might be our only shot. And as Lindy put, sustainability is you popped in, popped out, but long and slow, but effective. Caroline.
Yes. Hi, Jessica. It's good to see you. Oregon did have an Oregon Prevention Resource Center. We started out with something that's very similar. And I know the state of Washington also modeled theirs after Oregon. The only difference is the technology that we have now that we did not have available then. It was like a library, and we house, curriculums, we house different types of up-to-date pamphlets. So we got originals, and so people could print them. We actually printed them. We were kind of like a radar station. So I mean, it's possible. We also had a list of trainers. So if people wanted to be trained in a specific area that we could make referrals, we had a centralized place for any type of job openings. So you could go to one spot and do all those things. So I think, yeah, it is. And you guys are all correct. We did have money at that time. I think it was general fund dollars. And when, the state has gone up and down in terms of funding sources, and we did have to give it up. And we did have to split it within the Addictions Mental Health Division, but still carried on the same type of duties. So all your concerns, I think, are valid. But I think we do need something that's more centralized. The field is too rapid. There's too many new drugs that are coming out. And unless you stay active all the time, you don't know which ones are valid and which ones aren't. And sometimes you could get the misinformation. And so I think it's a good concept. So I think Beth and Jessica, I think we're going to be addressing all those things. And trying to keep up with the time. So I think it's a positive direction, but I understand you guys' concerns because some of us were involved with a lot of the conversations, and I know you guys are kind of coming on, but I think it's a good thing, and I think hopefully maybe getting involved in a subcommittee might be a way in terms of making sure your concerns are being addressed. That's just my 2 cents worth. Thank you,
Caroline. And I think when Wes and I were talking about this too, it was wanting to come back to this, and especially voting members, you feel a specific, I don't know, sector, or you represent a population. And I think we wanted to make sure, so I'll pick on Shauna since she's not here today, Tommy, and a lot with the early childhood and parenting. People don't necessarily always think, well, what would they do with substance use prevention? well, that's where it needs to start. So someone that's in that, we have our university people. Hey, how could we be, doing that better to support? Probably the majority of the students are underage. We have CCO, we have schools, we have a real variety, and we want you to come with that, your own personal, but also with that professionalism, that to be able to say, hey, how could I see utilizing this foundation? And we wanted to make sure, because I'm sure the prevention specialists that are on this meeting could say, oh, this is what we'd like, but we want to broaden that tent. And so that's where we really want your sphere of influence for you to be, it's okay to be really selfish here and say, hey, we've got Tim with public health that's having that bandwidth or that perspective to be able to say, this is how public health could utilize this, and we need to make sure these things are here. So all of you keep that sense about that as we build something that, from what I recall, Tim Rourke saying with us, that there were some examples across the country, but not really what we're trying to create. So we had the chance to do something new and innovative. Okay, Wes, keep going for us. Oh, wait, Tim, please.
Well, since you picked on me, I thought maybe I'd just chime in. No, I love all the feedback that's going on. Jessica, Caroline, Wes, your description, Debbie. I love the idea of what this Center of Excellence is. And thank you for bringing up, public health itself, the prevention work that has been built in and is a cornerstone of public health through the systems. But I love the idea of, what about the home visitor? What about those adjacent programs that can utilize some of the direction, the funding? Now, if we play it that way, like we do in Coos County, and Coos County is different than Deschutes, and it's different than, other counties, but my home visiting team is going to want quick information, right? They're going to be putting out prevention information to their families and their teams. So we're going upstream, but they're going to want to come back to some subject matter experts, whether it be behavioral health, public health, prevention. And that way it's quick and easy to partner with. So when we're talking about the spoke and hub, we have to build that out into brackets, right? It's not just a direct line from that home visitor or my WIC team to our Center of Excellence. We have to build in and utilize what we currently have as an infrastructure, our behavioral health, our public health prevention, to be able to get back and support them quickly and effectively by also bringing that information to our Center of Excellence and back through. So it's going to be a two-way. So that's the only thing I wanted to bring up currently, and I appreciate everybody's time.
Thank you, Tim. Very well said. This is exactly what Wes and I were hoping for.
This is great. Thank you all.
Let's go ahead and catch Lindy real quick.
Oh, sorry, Lindy, I missed you. I'm so sorry. I was looking up instead of on the screen.
Just a quick comment. I just wanted to add on to what Dr. Lynch said. I think at the local level, I'm here as representing ADPEP in Washington County and local preventionists. We already do that with very limited capacity. And so, I think it is kind of to what was just said, just building upon that and strengthening that existing network. Like our ADPEP program is connected to our MCF nurse home visiting, our behavioral health partners, and we do our best, but there's not a lot of capacity there. So I think I just want to echo that this is already happening in a lot of really meaningful ways, and I think it could be strengthened with more capacity and more support for those who are doing that.
Thanks, Lindy. And I think, we get, when I hear, capacity and things like that, sometimes it's like, oh, that we go straight to dollars, but maybe some of this is as Wes mentioned, we're trying to put these two efforts together with 3321, and a lot of it might be now we've got people coming to this table and telling us how to work more efficient and effective. And so we really are, because I can see those home visitors. There's so many things that I would like to share, because my job is not necessarily to go out there and do all the direct service, but they could be the ones that, hey, are doing that. But if they have things that are evidence-based and they can start to see prevention science, and prevention science is not just delaying substance use. And I think all of you really know that. So that's where we get to share in that mission. Thank you. Great comments. Wes.
Okay, thank you. All of this is already starting to the scoping conversation. Like you're already contributing to something. So let me just tell you how this is gonna work. We're gonna have these conversations over the next year. Y'all are gonna bring us information. You're gonna have thoughtful commentary like you did today. I think what ADPC staff in general is best at is taking large amounts of information and distilling it back to you all to say, are we on the right track? And we'll just keep saying, are we on the right track? Are we on the right track? We will check in every meeting to see if we're capturing the stuff that we're supposed to be capturing and trying to move to a unified vision of what this could be. To Beth, I really, really appreciated your conversation of like, well, this could be a major waste of time if we don't hit this right. That's why we're just gonna take it super slow. If we need more time on the timeline, we're gonna push the meeting out. I will say there will be times when I'm going to remind you all, let's not let the perfect be the enemy of the good, and let's prioritize about what we can get out the first year to move us forward, but we will be extremely thoughtful about how slow we move through this timeline. So if you see this timeline, this is the first go at it. This could reach out all the way through our midterm to our midterm. So this would be our short-term goal was to get this scoped. We have till 2028 to do that. Just remember that. January 1st, 2028, we have till that. This is to try to start to get ideas out the door by the 2027 legislative session. But that if we're not there yet, we're not there yet. So, the funding climate is the funding climate that it's going to be. So it's not like we have any pressure to move any faster than that. What I really want us to just to think about this as an iterative conversation as much as possible. Okay. Annalise.
I do want to just clarify because that last comment you made about the 2027 session, this is not tied to legislative session. I think Wes is just using that as a framework. We are not putting forward a legislative concept. We are not requesting funding. So I just want to be very clear on that and manage expectations.
That's right. Thank you, Annalise.
But it would be funded when we would request funding for the Center of Excellence, though, right? At some point. I mean, it has to be funded.
So that's why we have put so for folks who don't interact with the governor's office and executive branch on a daily basis, there's no money
Yeah,
for 27,
I know that.
right?
I mean,
so we
aware.
don't have anything to give up
right.
to ask for that. Like we don't have it. We don't have, my budget is my staff. So we can't propose it in 27. So that is why we really thought that that would be a 29 ask. Now that said, I think we all know how this works. If you actually have something formed, should there be funding before that, or should you all make findings through 3321 that you say, well, maybe it makes sense to move this money over here and this money over here, and maybe that is it. So there is contemplating what the funding is. I will be very honest with you because I have been in these conversations since literally the day I came to the ADPC almost 3 years ago. It's still not clear to me exactly what you're saying, what this is. Is it $100,000? Is it $1 million? I don't know. You don't know, right? Like, so you really have to scope it out before we can even get to that anyway.
Yep. And I think the only reason I use the 2027 dates is like we want to put good ideas out in the world, right? Like or at least avoid bad ideas. So if we have something where it's at least framed enough in our head and someone comes along and says, "Well, this is a center of excellence," we can say, "I don't know if that is," right? Like maybe we need to just pump the brakes here. And so I think that's something that really I'm thinking. But to Annalise's point, we have until 2028. The earliest we would be able to ask for money is for that 29 session, which would the planning would take place in late 2027, early 2028. So we have time.
And let me throw out a real wild hair because I get so frustrated with the money conversation because it starts to like, oh, take us away from just that building. And uh, it could be as we continue to talk about this, and Caroline, brought up real quickly, hey, we used to kind of have something similar to this. So, maybe there is an infrastructure that exists that it's with, hey, what if they had a little more support and we had these definitions and grounding, maybe it's not this big a ask. I don't know. It could be, it might be easier than we think as far as maybe there is something structurally, but if we can really stay, let's not worry about that. Let's build a dream and then go from there.
All right. Seeing some head nods and some thumbs up. Thank you, Debbie. All right. Ashley, I'll try to fly through these so we can get some more conversation going. If you'll pull us to slide 4, please. One more. There we go. Back one. There we go. Sorry. That was probably me. It was glitching. Okay. So in Third Horizon's presentation last month, they provided kind of just like a helpful little framework of all of the decision points that we need to make. And they largely fell into these 4 pillars. So one is the scope of work. 2 is the governance. So back to these questions of like who owns the center? How does that relate back to the existing infrastructure at a state and local level? How do we move that work? Pillar 3 is staffing. Who does the work? Some of the ideas that were brought up were kind of hub and spoke models where there were local liaisons. I heard a little bit of pushback from you all on that. That makes sense, but we'll have those discussions of like how does staffing work? And then pillar 4 is the sustainability. So how do we finance this not only in the first couple of years, but moving forward? So we've come up with a work plan to try to address each of those pillars. Next slide.
Just so you know, I want a Hemi for my engine. I don't want any like little tiny 6-cylinder.
All the horsepower we can get from Debbie. All right. So let's see. Sorry, Debbie, you just took me to my adolescence, like where we talked about engines all the time, like rural Texas, like that's all we talked about. Sorry, that just like threw me off. Okay, so here is the proposed schedule for this, and I'm already thinking that we're going to need another month on scope, so that's fine. But this was a really important conversation to get everybody grounded. So March and April, spend some time on scope. Again, Third Horizon will come and provide us an update on HB 3321. As we start to feel good on scope, we'll move into the summer into governance. Late summer, start talking about staffing. Third Horizon will come and provide us with a draft of HB 3321 around that time, of some of their key findings. September, we're probably going to need to spend some time with those findings as a group and kind of reflect also on what we've talked about so far with the HB 3321. I think that's really important. October, we'll have the final analysis. We'll need to start to incorporate those HB 3321 needs into the scoping conversation as well. November and December kind of as catch-alls, really thinking at the end of the year, this like sustainability and prioritization. But we might not be there by that point, in which case we will just keep the conversation going on scope, governance, and staffing. If we can get those three, then we can start to think about what do we, to Annalise's point, what is the money that we actually need for this? What does sustainability look like? And do we need to prioritize? Is there any money available to prioritize, or do we need to kick the conversation further closer to 2028? Okay. Next slide. Shifting back to scope of work, here are some five areas that Third Horizon suggested that we think about with respect to the scope. These do not have to be the 5 areas. I have a couple of questions related to, are there more things that we need to focus on? Who is the exact audience of these 5 pillars? But here are the things that broadly that we've heard over the last conversations. Resource portal, centralized clearinghouse for evidence-based and community-defined practices. Tiered training, foundational, advanced, and leadership pathways aligned with the MACBO certification. I think they're talking about certified prevention specialists there, but that could be broader than that. Rapid response, agile dissemination of training and technical assistance on emergent trends. So they use the example of synthetic drugs. Policy translation, conduit to translate field insights into ADPC policy recommendations. So someone to say, come to us that is seeing things on the ground level through state and local infrastructure, maybe already those conversations are being had. This could be a formal place to provide policy recommendations. And then academic collaboration. So some of the partnership that's already starting to occur between the workforce and our prevention scientists, is that something that the center could take on in the future or fund? Next slide. So I have a whole host of questions that are brought from y'all's questions to Third Horizon, and this will help us start to fill in some of this information. So I am going to put these in the chat and we can start talking and we can go any way you want. We don't have to take these in order. They can be, it just can be round robin. One of the things that Debbie mentioned earlier, and I think is really important for Luis as well, is that we do hear from folks who might not be in their formal role as a preventionist, whether that be through ADPEP or through a county, but maybe come to this table with wearing a different hat. So we're going to really encourage you all to speak if you don't already, because we want to make sure that, to the earlier point in the day, we definitely want the center to support the existing prevention community. That is 100% what we want to do. We also want to make it helpful for other people. And I think we just want to make sure that this conversation is really well-rounded. Okay, I think we can pull the slides down. I see Lindy's hands up.
Thank you. This is just a quick question. I really appreciate you bringing the questions that were submitted. Like, I know I see at least one of mine in there. It's like nice to see that thread. Sometimes you put stuff out in the world and you're not sure where it goes. So I appreciate the work you did on that. And I'm wondering if, as we are engaging in each of those questions as a group, do we have some sort of working document where we can refer back to? Because I'm sure we're not going to get through all these questions.
Oh, absolutely not. I'm not expecting you to. So I was trying to make this point earlier, and I'm sorry if I didn't articulate it well. I'm going to capture all of this, right? And there will be something that y'all are going to react to every single meeting. It's like, did I get this right? Like, you all tell me. and so like there will be continuous check-ins. And my hope is that when we get these notes cleaned up, I will start to build out like a scoping document, which would have kind of like all the things we talked about. Maybe it's even more questions, right? Like maybe this group raises even more questions that we need to come back to as a group and talk about.
Yeah, and I encourage you, Wes and Ashley do an excellent job when they send out our meeting materials because they really do a great job of the minutes and stuff. So if that's an example of what we have to look forward to, we are set really well.
Debbie, you're on mute.
Most people like me that way. Do we, Wes, do we want to how do you want to go? Do we want to take one at a time in order? Do you want to just say, hey, do what we have in the discussion questions? Do you feel like we've got the ones that we want? Anything else? How do you want to this next about 20 minutes? How do you want that to go?
So so I already heard some conversation on number two, and maybe that so if we can just start there, I think that would be great. So I heard the question came up from Jessica around around the existing prevention workforce. I think there is a desire to prioritize that group of folks. And then in some of Lindy's comments as well, it's like, how do we bolster the existing capacity of folks who are doing the work on the ground, as well as supporting others? So, who is the audience for the COE? Maybe let's just take some time to really sit with that. Because I heard from Dr. Lynch as well. It's like we need to reach out as much as possible. So let's have that conversation now, if that's okay, because we started it and it feels like a good place to warm up.
Beth.
Well, when I think about prevention, I think about schools. So I think one of our key audiences for this center has to be schools. And, the prevention programming that they roll out, oftentimes schools do need assistance with that. They want to learn more about evidence-based practices. They want tools or resources that are in this state free or easy to implement. And so I think, schools seem like one of our key partners here in a center of excellence around prevention.
Thank you. Tim.
And I agree that, Beth, you're right. Schools are the most important place to capture the audiences we're looking to help change these pathways to true prevention. And I think my question would be, if our audience is the schools that are doing some of the intervention and prevention right now, and they're requiring more information and they're requiring more resources, then would the audience be who we start to really build on the foundation, our behavioral health and our public health specialists that are currently doing the everyday work to be that first jump off point to bring in the teachers and bring in the schools? Because we already, as certain public health, have already built relationships with those schools. So I'm wondering if utilizing what's currently existing and then being able to build on top of that to move quickly into those spaces that need the support and need the extra resources, if that makes sense.
Thank you, Tim. Caroline.
Let me see how I'm gonna phrase this. I got some major concerns because of the fact that I remember my earlier years of doing prevention. I was championing a curriculum within the school system. And then I had a whole bunch of parents who came in and really got upset with me that their kids were actually confronting the parents from some of the things that we were teaching them, specifically around what alcohol does to the body. And so they went home lecturing the parents, and the parents were upset with me. So I'm concerned that we have to look at more of a comprehensive approach in terms of what we could provide for families, parenting, what we could do for them, as well as what might be existing within the school. And then again, it opens up the Pandora box for some children that's going to probably cross the line in terms of needing more type of intervention or treatment. And so we need to make sure that we have whatever we do, we could target schools, but we need to target the families, parenting, and we need to make sure that the community have some type of things for prevention, and then the individuals, and then we need to do the span of control in terms of ages. We got to do prenatal all the way to the elder population or senior population. And so I think we need to take all that into consideration.
Thank you, Caroline. Lindy.
Yeah, this is great. I love what you just shared, Caroline. I think I would love to see maybe perhaps like a phased approach of who our audiences are, so that we're not trying to reach everyone and all at once. Because our approaches are going to be different based on sectors, based on community. And I think it would be great to start with the folks that are already engaged in prevention work to some extent. Maybe they are getting like an OHA grant, ADPEP coordinators, TPEP coordinators, coalition folks, and just because those are the folks already really invested in prevention. And then maybe the second phase would be we start to add in schools, add in community, CBOs that are not already in that. I think it could be hard to just launch something all at once. And we haven't really heard from the sectors that aren't super engaged right now what they need. So I think there needs to be some conversations and engagement before we just put everything out into the world.
Thank you. Continued hands. I'm going to go off script a little bit if I could. Oh, Alexa, please.
I think from the college perspective, I would say probably administrators. So if those are professionals, clinicians on campus that are doing the prevention work, but I think in general, it would be kind of what we're speaking. Like I like what you're saying, Lindy, about the phased approach. And I think that definitely is applicable for the college realm, is especially initially, and I think onward would be the administrators that are doing the prevention work. It's varied on every type of campus who's doing that. But I think I'm also, what you said, Caroline, about the families and parents, we have a lot of conversations about how to involve parents of students as well. So that's something I want to kind of think on more for the college perspective. But that was a thought I had as well, was how do we, because I do think there's a need to educate parents and families, guardians and whatnot of college students. So that's an interesting one to think about as well.
Thank you. Zeb?
Yeah, thank you. Yeah, I was sitting there thinking about the overall issues and problems and stuff, and I think Caroline hit it on the head, because it takes us a community approach, holistic, comprehensive approach. Because by what Caroline is saying is true, going back to my own youth, like we had great prevention programs in the school, then a bunch of us would go home to parents who were in active use. And it would cause, if you brought it up in discussion, it did cause problems in the family, because the parents were feeling attacked. So I just wondered, the comprehensive approach is best, but do we have this? I'm just saying this, do we have to start off small, take a community and put resources in to seeing how that approach can work, as opposed to thinking too broadly at the beginning? Or, because that takes a lot of effort and coordination to see that model through. It's kind of food for thought.
Thanks, Zeb. Darren, I think I saw your hand for a second, then it went down.
Well, I had to step out for a second, so
Oh.
I wanted to pick up, but I wanted to contribute, but I wasn't sure what question we were on. Were we on the audience? Are we on number 2? So
Yes.
we're discussing. Yeah, and I don't know if anybody, I love what's been shared and especially what Zeb just shared. I think thinking about scope and scalability and that kind of stuff is important at the beginning, as I'm sure you all do too. But I'm representing kind of the FQHC world and when I think about our services, which are pretty wide ranging, we have school-based, we have a whole district that we're responsible for providing both school-based health services and behavioral health. And then we have our specialty programs and we're in primary care too. I mean, I assume most FQs have community outreach departments and those kind of things. And I think that would be definitely, we have a big traditional health worker um, uh, team on our FQHC. So I think that would be important, along with our behavioral health teams would be that. But we don't do a lot of primary prevention, but we would need to be in the know and have a lot to contribute for that. Especially in school-based areas, I just feel like that's a really tight place where providers and schools need to partner. And this seems like an area where that would be really effective to get the word out and get people focused in on the center of excellence. But I'm not sure if that made much sense, but that's kind of my contribution from my realm.
No, good point. And just that's make sure I'm saying this right. Federally qualified health center.
Yeah, federally qualified health centers.
Thank you.
Yeah,
Okay.
community health centers.
Okay. Thank you. Anyone else? Jessica, please.
Yeah.
Darren, do you want to finish your?
I was just going to add, because I just realized that maybe the whole audience isn't familiar with the FQs, but FQs hold around the state, probably hold most of the school-based contracts. I would imagine they have all those school-based health centers. So probably goes without stating for most people, but that's just,
No, thank you. Thank you for that clarity. I don't have one of those in my county, so I really appreciate that. Jessica.
We have 2 FHQs in our county, and it's great collaborating with them. I just wanted to share, I guess, kind of the frame that I'm coming from, which is that our prevention staff in Deschutes County, and actually even when I worked in Benton County, this was the case as well, really were considered kind of like a hub of expertise themselves. So meaning that if we were trying to make some improvement in a school area or a federally qualified health center, in a home visiting practice, like it wasn't the prevention expert to know how to teach, nor to know how to deliver, physical health, but rather it was their hat to wear to ensure and that the new practice, the evidence-based or tribal best practice was being utilized and helped to coach that system through utilizing it, because we've never had enough prevention expertise to actually have our prevention specialists in schools to teach, but rather our sustainability component was helping to shift the system so that the school or the clinical practice or even our law enforcement or our faith-based communities were adopting and implementing the practice to create that sustainability component. So I share that because that's, I guess, my lens that I'm thinking about the prevention workforce, and where I think like I like the idea of starting and bolstering and ensuring that workforce is a focus because of the limited funding, because over time I have seen additional prevention work come into my community, and it can confuse things. An example is suicide prevention. there was a point in time where, everybody was doing suicide prevention, which was actually really fantastic. But if you don't have it coordinated and have kind of a hub in your community to make that focal point toward that everyone kind of moving toward the same thing, then it actually can be kind of crazy making and maybe not the best use of our resources. So so I offer that just to, I think one of the values that I would love to see the Center of Excellence have is that it's anchored in supporting and valuing the local expert. The local expert knows their community, knows how best to operate within, yeah. So I'll end there.
Thank you, Jessica. Anyone else? Voting members first. Really appreciate all of you guys being willing to put some perspective on this, because that's exactly what we need to hear.
Can I ask a question? Maybe this is a rock the boat question, but I want to put it out there. And I recognize I'm recognizing a couple of conversations I've had in the last year with different players in local communities. And this is not, and I think it's really important not to paint Oregon with a broad brush of like this is working exactly the same in this community. So, I'll have ADPEP coordinators in unnamed counties say, I cannot get a hold of my schools. The same day, a school will say, man, I can't get a hold of my ADPEP coordinator, or vice versa. Or like there's some disconnect between who we fund as our traditional prevention workforce and that community entity, whatever it might be. And it might be, personal things that go way back, or it could be a whole host of things that cause that disconnect and make it kind of compound historically. I want to ask this question because Lindy brought up this kind of tiered of like we start with a prevention workforce, which I think is, and I think I'm hearing that from a lot of different people. But we really don't know what the other sectors need. And sometimes it's that connection to that local community resource. And I'm wondering how we utilize some of the state assets that we have, state and local assets that we have that kind of coordinate those other sectors. So a good example is schools, right? We are building a really robust partnership with ODE. How do we get Alana into this conversation to like support us with respect to I just gave a schools example, right? Like where, there's either issues or turfiness or whatever that might be happening at a local level. How do we support and give communities options while also maintaining robust support for the prevention workforce? I'm just putting that question out there.
Okay, and to go, I'll call on Lindy, then Tim. Just maybe, well, I'll wait and then I'll share. And go ahead. I don't know who was first, so I'm going to go who I see on my screen first. Lindy.
Yeah, I think that's a great, thing to be thinking about is where those disconnect points are. And I think part of the issue that I see within our workforce is continuity and like longevity of people in positions. This work is highly relational. And if you have people coming in and out of those key coordinating positions and you don't have great transition plans or, here's your new point person, I think some of those relationships can fall to the wayside, and especially with schools. It takes a really long time to build trusting relationships with the schools, and I think they're more successful when they're not mandated and rather built on that relational platform. So I just wanted to underscore that that's super, super important in our work. And I think if folks in the prevention system were better supported and we were able to keep them around longer, then, I think some of those other things we're seeing where there's lots of disconnect would be addressed. At least that's what I would hope.
Thanks, Lindy. Tim.
Yeah, thanks, Wes, for that question. I think you identified something that happens around the whole state, not just this state, but other states as well, rural and urban. And Lindy made a very good point that it's about the relationship and the high turnover, depending on where the location is. If you're in a metro area, maybe it's easier to get really reconnected where you're in a rural area, and it may be more difficult because of the workforce issues that happen. I think to answer your question, Wes, if we're looking at prevention from a public health standpoint, or we're looking at our FQHC prevention or our behavioral health, whatever dynamic we want to choose that works for that region to be one of the frontline partners, then they have that. We may have to ask them, and that may be part of what we build in, that we need you as the point person for this county to connect with your schools, your colleges, your other entities, whatever we feel is most appropriate that we are marginalized or maybe on the outskirts that don't get these options. We may require them to check in and give, feedback. Where have you contacted? What are the needs within your county? Because not one size fits all. And we have to identify that when we start building this structure, that we're going to have to do some kind of investigation from that leadership, wherever it is. And that may be able to drive that force, Wes, that you've identified and that gap in serving all of those entities. So thank you for bringing that.
I'm trying to capture this in like a couple of words, like really acting as a table setter role, potentially, as like where there are these big disconnects, maybe sitting with folks and sitting with that uncomfortability, or making sure that people have a good awareness of like all of the different partners that might be in their community, if they have a view on that.
And if they're going to be a lead, they're responsible to go out and connect and get feedback to bring up that chain. From a public health standpoint, I have home visitors that deal with schools. I have my nurses for clinic that deal with schools. I have my prevention team that deal with schools. So if there's one avenue that's missing, there are multiple avenues already built within that education system for the county. But I guess giving that requirement, hey, we want to hear back from this within your county and see what their needs are.
Okay, we're getting close to public comment time, and I think this will be really appropriate. Some of you have used the chat. Myself, as I've listened to this and listened to Wes's question, I so appreciate. I think I remember Jessica. I think it was about 11 years ago. We were at, and I don't remember what it was, but it was public health. Was doing their conference, and it was the first time we were supposed to be blending, and prevention was kind of going to be at the table, and I feel like things haven't really moved quite as far as I'd hoped, but right now this is a big thing. And I think I remember I was describing it as prevention is kind of like the old world where we're an arranged marriage. And we have a lot of people that are thinking maybe we'd be a good match, but we haven't really figured out what the prevention workforce does, because some people are defining that for us by their understanding. And sometimes the prevention workforce kind of does its own unintentional harm of trying to, well, this is where I got to go because this is where the funding is. And I think with this representation that we have here, I'll specifically call out public health and the schools. We have this opportunity to look at and say, hey, you have a certified workforce, which has kind of gotten the shaft a little bit, and I'm not putting any blame, but the certification process has not carried through. That's just the way it is. So as we're bringing people into these positions, we need to make sure they do have science prevention credentialing, or at least know what goes in, what is and isn't primary prevention. There may be some opportunities at the schools where I know Alana shared with me, boy, everything that goes into Division 22 requirements. It's a lengthy list. There's lots of title funds. There might be such for a school district to say, boy, it would be better for me to contract with whoever my local expert is and have them help me do that plan, help me do some of these things where it could be a contract instead of hiring a full-time person. But we need to be able to have that primary prevention expertise, not just in substance use. I know we have Roxanne here with gambling. We have some of our public health experts. I could say, boy, at maternal and child health, what are some things that we can share this basic knowledge of upstream? Where does it be? Maybe the workforce can help with that, or maybe it's where we're the connector. But right now, I think we need people that are in positions such as Alana, Tim, Jessica, our college people, to be able to say, how do we even get through that door? Because we don't know how. And we want you to tell us, hey, this is how to enter in and how we can work together. We've got Jill Pearson here, pediatrician. How could some of these primary prevention messages be shared with a pediatrician in well child visits? There's so many opportunities. So having the people that play a role telling us, hey, this is how I could use that knowledge and I'll send it to you. So I think we really got to think outside the box. But I just think that we are arranging a marriage that right now needs a marriage counselor, but very soon I think it's going to be something that's very fruitful and is going to be a model across the nation. So hang in there with us. I want to make sure we're at that public comment time. Put something in the chat or raise your hand as far as this discussion, because you play an important role in this also. So if we have any people that would like to share in this discussion, or you had something else specific that was not on the agenda that you would like to share out to the primary prevention subcommittee, we'd love to hear that right now. Sarah, please.
Hi, everyone. I just wanted to, I'm Sarah Lochner, she, her pronouns with the Coalition of Local Health Officials. So I just wanted to put in a plug and let you all know that CLO has sent a letter to the Opioid Settlement Board requesting that they consider making their prevention funds that they issued last year through the ADPEC programs, making those funds ongoing, because as you all know, it is very difficult or impossible to build a primary prevention program on one-time funding. So if anyone wants to pile on and offer a letter of support in that direction or provide public comment, the next meeting is April 1st. And as long as you get the letter to Lisa Shields by the day before, who Lisa is the OHA staffer that staffs that. I'm sure Annalise could also help connect. Would love to have any and all of you pile on to that request. So thank you so much.
Thank you, Sarah. And I think Sarah brings up an opportunity that eventually maybe this hub and spoke model could be where that could happen, where people could be all collaborating together and see the importance. So right there's just another thing that could happen. So thank you, Sarah. Alana.
I knew if I didn't speak, Debbie, I thought I was going to get called on because
well, it was close.
Such a school focused meeting. First, I want to say, just from like where I'm sitting at ODE in the school perspective, I feel like this conversation really is thinking about the dynamic and partnering with schools the right way. I slowly checked off all the comments that I had on my list because you all had already mentioned them and some of the thoughts that I had. I liked, I think, Lindy, it was your approach of, I do think it's the right approach to start with your prevention workforce when it comes to, even if your goal audience is schools, because we do have really robust relationships across the state with our schools and our prevention specialists in a lot of areas. And as Wes mentioned, in a lot of areas, those partnerships are not as strong as we might like them to be. And so this isn't even necessarily a fully formed like thought. I'll just throw it out there is that I think if there's an opportunity for a coordinated effort between y'all's work and my work to do engagement of schools to better understand why those gaps are existing. It's something that we are working a lot on at ODE and are trying to understand to build those bridges better. And I think that schools are really the ones that are going to be able to tell us where they're running into barriers and what types of connections and resources would best serve them. And so I just think there's an opportunity for us to do that coordinated outreach to schools and do some really authentic engagement to inform this process if that is something that this group wants to engage in either now or down the line. And I also think like I can support y'all's work as well when I talk to schools about their Division 22 requirements, especially as you scope this out. If you keep those in mind and they're aligned to those state level requirements and our standards and things like that, it makes it really easy for me to be able to point schools towards something like this when we're helping them develop out their substance use prevention plans or select curriculum and things like that. It makes it a really easy path that we can support the work that you're doing. So I wanted to name that. And my final thought that I had is just, I think Caroline had mentioned this at the beginning, is like schools are inherently across the continuum of care when it comes to substance use, just by nature of having a primary prevention conversation in a classroom. Someone's going to come up to you in tears at the end and say that they're struggling. And now you're in a tier 2, tier 3 moment. It's just inherent. And so as you scope it out, even I understand the Center of Excellence, your scope might be primary prevention, but if you're one of your target audiences is schools, I think it's just always important to keep in mind the need to be able to connect to other resources across the continuum of care because they are inherently in that position of needing to provide that support.
Thank you, Alana. I think that's really important. And just personally, I can speak to how responsive Alana is. I now have 3 schools within my county that I know their plan is going to be more science-based because of the help that we're receiving. So we are starting to see faces, like Lindy said, make the relationships, feel comfortable calling and say, hey, how can we help this? Because the last thing I want to see, many of you are aware of the Lund report, maybe that's been about 18 months ago. We don't want any of our partners to feel like they're getting thrown out under the bus. We want everybody to feel like they're a part of this and they have a seat on the bus. So it's continuing to talk, ask tough questions. We've got about 6 more minutes. Any other comments? This is your chance. I will, Roxanne, don't worry, I won't make you talk. Roxanne Jones, who is over, heads our gambling prevention. Again, this prevention science isn't just substance use, it's other risk factors that we're looking at with our young people, whether it's screen time, social media, gambling. There's lots of things going on. So this kind of be all encompass. Jessica.
I won't make you speak either, Roxanne, but I wanted to, because Roxanne is here, I was just reflecting on my experience with across our state and different technical assistants. And I've just always been really impressed with the problem gambling state office and the technical assistance that does come. It feels, when I look at the pillars that were just named in a prior slide, I feel like, Roxanne, your team kind of has has some things figured out that maybe, I don't know if you have a blueprint, but might be helpful. But it's just always been very timely, you know, catching our staff up to speed on emerging issues, providing regular collaboration across the state, so that our staff have colleagues to share with and learn from. And so I just wanted to give a shout out to you.
Well, thank you. And my background is primary prevention, and I've been at it for I'm going to age myself a little bit here, probably over 35 years. So, but thank you. And we're definitely here to support and see how we can partner when it makes sense as well. So, thank you.
Yeah, be careful when you come to one of these meetings. Okay, anybody else? I see some of our partners in Lines for Life, so we really appreciate them being here. Again, we have people that we can only have so many people on our voting membership, but we've got Arnold from OLCCU, and I know I'm dropping names and I'm forgetting many of them. We really appreciate you coming, and we will always find time for you to share, because this work is definitely about everybody. And I think when we get, back down to it, it is what can we do to help our young people move into thriving adults? It's going to take all of us, and we need your expertise. We need your policy guru-ness. We need your passion. We need your quirkiness, all of it. So with that, Wes, anything you want to add?
I'll just close this out by saying we got a lot of information today. This is very, very helpful. I will start filling out some documentation so that you all have time to reflect before the next meeting. Debbie and Luis and I will talk about how to structure that conversation to get to some more of these questions. I think this was really, really helpful. Y'all made a lot of progress today, so I appreciate it.
Again, thank you, everyone. Feel free if you were like, oh, something came to your mind, shoot Wes and I an email. This is going to be better with all hands on deck. So I welcome you to for being here again. I'm trying to make sure I get everybody. Lots of shout outs to ADP staff. You're amazing. We are on somewhere. And I gave you my arranged marriage analogy, so don't go out. You're already married to this group. Okay? So thanks, everyone. Have a very good rest of your spring break, and we will see you in April. Thank you.